Health Cabinet Secretary Aden Duale appeared before the National Assembly to defend the progress of the Sha scheme. He reported that more than 40,000 Kenyans are enrolling daily and reassured the public that the registration process is entirely free. He also warned against individuals exploiting the public by demanding money for Sha registration.
Secondly, we have a very inadequate awareness on Sha. Despite the 40,000 Kenyans registering every day and above, there is a manipulation of the mean testing tool, resulting in very accurate premium. There are people who take Kenyans and want to guide them, take money from them. I want to tell Kenyans to register for Sha is free. Nobody should charge you anything.
Despite these updates, lawmakers expressed dissatisfaction with the Ministry of Health's outreach efforts. Members of Parliament argued that many Kenyans remain in the dark about Sha's purpose, progress, and benefits. They noted that most of the information about Sha is confined within the ministries and has not been adequately communicated to the public.
Mr. Speaker, our concern is, today as you speak about Sha, the only story that is out there is about the teething problems. The concern is this ministry having any tangible plans to put up proper sensitization and communication campaigns to allay the fears that Kenyans have? Because the questions that Honorable Kawanjiko has are the same questions Kenyans have there. The information sits at the ministry. However, it does not trickle down.
What you are saying, using health workers, what specific programs are you putting in place to be able to educate the people on the ground to be able to register themselves with the Sha? Because it's important. You are doing very well. But what specific program do we...
Speaker of the National Assembly, Moses Wetangula, on the other hand, emphasized that the main issue undermining the Sha initiative is lack of effective communication strategy. He pointed out that the ministry has been slow to counter misinformation.
It does appear that the elephant in your room is poor communication. Information flow is flawed or non-existent. But you rightly said that you want to go out on a serious public awareness campaign. That's something you ought to have done yesterday.
In response, Aden Duale reiterated the government's commitment to the success of Sha, positioning it as a cornerstone of the broader universal health coverage agenda under Taifa Care. He mentioned that the program is functional and beneficial, aligning with the president's vision for healthcare reform in the country.
Listen to the naysayers. Over 40,000 Kenyans are enrolling in Sha every day. Take charge of your health care and enroll to Sha. Universal health coverage, Taifa Care is working, is good for our people, is a legacy. All our leaders, led by the president, we are going to leave.
Reporting for Tandao TV News Outlook at 1, I am Marilyn Masika.